Why thyroid? Thyroid is an issue that comes up for about 10% of Americans, and about 80% of those people have an autoimmune thyroid. If you get treated for this with just thyroid hormone, which is the standard treatment for hypothyroid, the most common thyroid issue in humans, that can be a very effective treatment, and it is the standard of care. However, if the patient has an autoimmune disease under which their immune system is attacking their thyroid gland, there are a whole host of things that need to be examined. The destruction continues to happen in this individual, even if they get the Synthroid, because it doesn't stop their immune system, it just controls their thyroid production. So what we need to do is figure out what could be triggering their genes to produce these immune system cells, these antibodies, against their thyroid. And if we do that, we can begin to give them a better quality of life and fewer symptoms without changing their medication at all. So you see, we're not really treating the thyroid, we're looking at the immune system. And our way of doing that is to do blood tests and saliva tests and other metabolic tests, very often stool tests and hormone tests, and gather information, put that together in a scientific fashion, and also to use physical exam procedures. We do things like palpation, feeling the gland, and more importantly, neurologic exams of the brain. Now you might ask, why would we examine the brain for a patient with thyroid or for any other condition, especially an autoimmune condition? And the reason for that is because the brain regulates the immune system. This was discovered in the 1990s, the decade of the brain. NIH, the National Institutes of Health, provided millions of dollars to universities to do studies with brain imaging to see what the brain controlled and how it did the controlling. What we learned was a number of things, but about autoimmune disease, we learned that the right and left sides of the brain control the immune system and the hormone system. So in certainly a small number of patients compared to the masses, there are people that haven't gotten better. And one of the reasons that they haven't gotten better is because their problem is in their brain, in the relative firing of the left versus right or the front versus back, different areas of the brain that are not firing well in concert with the rest of the brain. If that happens, the descending regulatory signals that regulate the glands don't work very well. And so no amount of supplements will help these people until someone comes along and stimulates their brain precisely to those areas that are weak and need stimulation. That's how we break through some of these cases. And certainly we can't fix everyone. But we have found quite a bit of results with those very difficult patients who have tried everything herbal and have tried all the supplements in the world. The neat thing about once you fix the brain is that then the supplements begin to work.